You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, healthy aging. With us, we have LA's go-to doctor when it comes to healthy aging. With us, we have Dr. Howard Leibowitz. Dr. Leibowitz,
Thank you, Randy.
welcome to the program.
Thank you. I'm very happy to be here.
Now, I met you, I think, probably about 12 years ago, 11 years ago, had you on my show. And so I have a lot of questions because I guess you're better now, as you say, than you were back then as far as getting
Older
results.
and wiser, that's right.
Good. For people that don't know you, tell me a little bit about the patients you see. I mean, who's the typical patient in your practice?
I have a very personalized practice in Santa Monica, and it's alternative based, and I treat both men and women. And a lot of people come to see me because they're getting older, and they just feel like they're slowing down, and they're sort of losing their edge. They're not really sick. They don't necessarily have a disease or a problem per se, but they just want to stay on top of their game as they get older, and they just want to not lose all of their abilities.
So like for example with the women, because you do bioidentical hormone replacement therapy, is it the 40 plus crowd?
Most of the women are probably 45 to 60, I would say.
Okay.
And most of the women are either in or going through menopause, losing their hormones, and developing a whole myriad of symptoms. They could be just developing some brain fog, low energy. A lot of women start putting weight on as they start getting closer to menopause, low energy, difficulty functioning in life.
Do you see reversals in those symptoms?
Tremendous. I mean, it's amazing in a week or so when I start women on hormones and get their hormones balanced. It's like light bulbs going off for them. Tremendous improvement.
You told me on the telephone, you said, Randy, I have 75-year-old women that are still having sex.
That's true.
Is that right?
That's amazing, yeah. And they love it, and they feel great. And I hear this every single day. You know, women will come in and they've been suffering for a long time, and they see traditional doctors. A lot of doctors don't even think that the symptoms they're having or experiencing could be related to their hormones. Or they'll say, you're 70 years old, you just have to live with it and suffer. And a lot of these women come to me and they just don't want to accept that. They don't feel like their lives are over. And they just, they're interested in some options. And many, many times I can start women on hormones. And as women are older, I tend to be a little more conservative than women who are younger, going into menopause.
What are the younger ages of the patients?
The youngest woman, and this is unbelievable, but the youngest woman I've ever seen in menopause was 28 years old. And I've seen many women
What defines menopause, by the way?
Well, traditionally,
like a 28-year-old is in menopause.
Traditionally, it's a woman who is not having a period for a year, and I think that's a barbaric definition. When I evaluate women, I look at their hormone levels, and the FSH, which is a pituitary hormone, comes out of the brain. When that starts to go up, that's a sign that the woman is no longer ovulating and she's not making hormones. And the thing that's really interesting about this is I've seen young women in their 30s who are in menopause or going through menopause, and they'll go to their doctors and they'll say, I'm not having a period, or I'm having these symptoms. And the doctor will go, you're way too young to be in menopause. And they put them on the birth control pill.
Okay.
And they
That's
come
a
to my
mistake?
office.
Is that a mistake?
They come to my office in menopause on the birth control pill.
But why is that a mistake?
It's the worst thing you can do for them.
Really?
Because it actually perpetuates the symptoms of menopause. Their brain doesn't function. They don't have any hormones. Hormones are neurotransmitters. So they send the signals in your brain to make all the connections. And when you don't have hormones, those signals get cut off, and the brain just doesn't function as well.
Some people do feel better. I know somebody in particular says without the birth control, she feels lousy. So it does work for some people.
Well, the only thing it works for is controlling the period because it stops the woman from ovulating. Actually, the birth control pill, my definition of what the birth control pill does is I call it chemical menopause because it stops the woman from ovulating. She doesn't make her own hormones anymore. She's only getting these artificial hormones from the birth control pill. So her periods will get less, her ovaries will shut down, and she'll be technically in chemical menopause.
Okay. So they feel better. I mean, that's the main thing. More energy.
Much better.
Better sex drive. Men too? I mean, what are the men you see?
Well, basically, I put back hormones that were there before. I'm not trying to recreate some new entity. And that's the thing about the birth control pill. It's totally artificial. It's not following normal physiology of the human body. And one of the things that I do is I try to keep things as natural as I possibly can. And by putting back the hormones, I put back what was there before. They're all
like
bioidentical.
replenishing hormones?
Yeah, they're all bioidentical. They come from wild yams. Can you imagine that?
Okay.
Hormones coming from wild yams, but they do. And they're chemically identical.
Who makes them? I mean, these are made by a compounding pharmacist?
The compounding pharmacies will buy the hormones as powders, and then they blend them together into creams and other delivery systems. Sometimes we use drops under the tongue, sometimes we use creams, and now, as we've talked a little bit, as I'm using them as pellets, and we plant pellets under the skin, both for men and for women.
You like them?
Pellets are
I asked
amazing.
you on the phone, is this a gimmick? Is it gimmicky?
It's not a gimmick. The pellets are amazing because you don't have to do anything. Now for women, they have to take some progesterone because I don't like women to have progesterone every single day. They never have that normally.
So how do they take that?
Except when they're pregnant.
A pill or a cream? Or?
They take drops under their tongue, only 2 weeks out of the month. And the rest of the time, it's like having artificial little ovaries planted under your skin. They dissolve over 4 to 5 months, and they slowly secrete their hormones directly into your bloodstream, just like the ovaries did. And for men, it's the same thing with testosterone, except they don't have to do anything because they don't have to cycle their hormones. So I put in the testosterone pellets, and they just dissolve over 4 to 5 months. The men go along.
Sounds dangerous, though. I mean, people must tell you that, hormones are I had a guy on the phone today. He says, Randy, he goes, what about growing cancers?
Sounds never dangerous. Been a study. There's never been a study that shows that hormones produce cancer.
Okay.
And the more times they study hormones, and the more information we're learning about hormones, the more we're finding that hormones make people healthier. And it's a huge discrepancy. And I run into this every day because a lot of my patients will come and consult with me, and then they also have another traditional doctor on the outside, and the traditional doctors are telling them, oh, you shouldn't do this, you shouldn't do that, and the patients get very confused. But there's so much data out there showing how hormones make people healthier and healthier. Absolutely. The thing that's very interesting about this is as we get older, the biggest thing that changes in our life is our decline in hormones. And exactly associated with our decline in hormones is our decline in health. And you could look at every parameter. You look at cancer, look at heart disease, look at diabetes, look at obesity, look at strokes. When do those diseases happen? They happen when we're older.
The 50s, 60s.
And that's exactly the same time we lose our hormones.
So do you, and people need to know this that are tuning in, we're talking about functional medicine with what I said is the go-to guy in LA for functional medicine. And this is a real interview that, we haven't practiced this, and I'm not endorsing you, by the way, but it must come up all the time, like we just mentioned, that it is dangerous, especially pellets. I've had doctors, medical doctors, that tell me, Randy, the pellets I don't agree with.
If they're done right and they're monitored correctly, and this is what I do, I follow blood tests with my patients. I don't just pick random doses. And everything is scientific. And there's a lot of great data out there. And actually, if you go with the literature and you look at some of the most prominent people in the field, I can mention names and articles and everything, these people are in favor of pellets. There's a tremendous amount of supportive information on the
now, you write
internet
a blog.
about it.
You write a blog. Do you talk about this at length on your blog?
Often, yeah. I have articles on my website about the pellets, about the hormones. I talk about these controversies. I cite the articles. I cite the controversies of the different opinions on the hormones and all of that. And I also, when I see a new patient, I educate them. I do a tremendous amount of education in my office.
You say you're a coach.
I'm a coach, but I give it's like that, and I give them a playbook. And seriously, it's a book, it's a manual, and it's probably 80 pages. And I hope they read it. I don't know if they all read it, but it's a tremendous amount of information. And I educate my patients and I teach them how to take control of their life, how to make themselves healthier. And I tell my patients, I say, I'm the doctor. I can't do this for you. You have to do it. You have to eat right. You have to sleep. You have to avoid toxicity. You have to do the exercise. I can give you the hormones and I can write out the plan for you, but you're the ball player. You have to do the practicing and you have to go out on that field and play the game. I'm on the sidelines as your coach. And the patients who are the most successful, they really take this on. And I am amazed sometimes at how successful some of my patients are. I had a guy, he came to my office, I hadn't seen him in 3 or 4 months. He was probably 60 or 70 pounds overweight. And I ran over his blood tests, and he had high blood sugar, he had high cholesterol, he had high blood pressure. You go down the list, he was a ticking time bomb. Heart attacks, strokes, diabetes, you name it. And I didn't realize this at the time. When I was explaining his results, I was just going over his results. He freaked out. And he went home and he did everything I said.
Yeah.
He came back to the office 3, 4 months later. I didn't recognize him. I'm looking at this guy, I'm like, are you Steve? He lost 70 pounds in 4 months.
Is that right?
He was, and he's a good-looking guy, but he didn't look that good when he was 70 pounds overweight.
Okay.
But I said, wow, you're so handsome. He was amazing.
Do you have equally good stories with women too?
Oh, yeah.
Where it's like
Women
a total
too.
transformation?
Women too, yeah. The women.
Is their attitude, their charisma changes? I mean, if you feel better.
The biggest
obviously,
thing with
everything.
women, you know, and I don't know if you've ever been with a menopausal woman, but a lot of menopausal women just have a total change in their personality. And it's not their fault. They lose their hormones and their brain is just completely different. It's just they're not getting the signals. It's like if you went into your car and started snipping wires.
So rattle off some symptoms. A woman that
Typically
knows.
anxiety, irritability, brain fog, of course the hot flashes, night sweats, sleeplessness, weight gain. They get what's called muffin top, you know, that layer around the middle. They don't want to do anything. They don't want to have any sex. And the thing that's interesting about this is I coach a lot of what I do. I love the paleo model. The paleo model, we can talk about diet a
That's a
little
way
bit.
of eating, right? Paleo
Well, it's
diet.
more than the way of eating, because I love the genetic foundation of the paleo model, and it really underlies everything I think in health. And if you think about it in terms of libido, and you think about it in terms of menopause, what happens to a woman who, in Mother Nature, in the world of Mother Nature, what happens to a woman who no longer is able to reproduce? Mother Nature doesn't have any use for her,
Okay.
right? Because we're all about procreation. We're all about propagation of the species. We tend to forget that. You know, we're just human animals like all the other animals on the planet. We think we're better and we could do this and we could do that, but we're not. We're designed 100,000 years ago.
So
Very
women
primitive.
what? Start wasting away, in a way?
It's not that they waste away, but they're no longer procreation, so Mother Nature just like throws them off on the junk heap. So they're not going to want to have sex, and it's not their fault. They're programmed that way because they're going to push the man away. Why should a man have sex with a woman who can't reproduce? He should have sex with a woman who can have babies. That's what Mother Nature wants him to do. Doesn't that make sense?
Okay.
That makes perfect sense. So women get like this, and then they start to get sick. So the risk of breast cancer goes up after menopause. The risk of osteoporosis goes up after menopause. The risk of heart disease alone, the biggest killer of women is heart disease, starts after menopause. So Mother Nature keeps women healthy when they can reproduce, so they can have babies and take care of their babies. But when they no longer need to have babies, Mother Nature says, we don't need you anymore. Get sick and die.
So by replenishing their, I want to make sure I'm catching. Okay, so by replenishing their hormones, you're saying that they start feeling younger, acting younger, and those symptoms go away?
It maintains, we trick Mother Nature. We trick Mother Nature.
So this
into
is like
thinking.
modern medicine in your opinion. I mean, this is the new way of aging.
I think this is the way medicine should be going, because one of the things that happens with a lot of these women, it's very sad, because I see this all the time, is they go into their doctor's office and they're not happy. They're gaining weight, their brain doesn't work, they're bitching at their husband all the time, they're yelling at all their friends and their kids and all this kind of, and they don't like that, they don't want to be like that. So they go to the doctor and they go, something's wrong with me. The doctor says, well, I'll give you an anti-anxiety medicine, I'll give you a sleeping pill, I'll put you on antidepressants. And he just loads them up with drugs. That doesn't correct the problem. It's just putting little
Does that
Band-Aids.
really happen? That really happens?
That really happens.
Okay.
It's just putting little Band-Aids on the symptoms. Traditional medicine is symptom-based medicine. And my whole approach to medicine is what's called functional medicine. Functional medicine is getting to the root of the problem and fixing the root, correcting the problem, so actually the problem goes away. It's not just putting little
So
patches
I
on
read
things.
your website, and we're kind of short on time, but the right nutrition, right kind of exercise, supplementation when necessary, and hormones when indicated or needed, etc. Right? I mean,
Yeah.
that's
well, I
the
have the 5
basics
steps. I
that
have my
you-
5
What
steps.
are the 5 steps?
5 steps. And this is on my website. You know, I write a blog, and I publish these newsletters, and people can. I'm happy to let people come on the website. It's free. Just come on my website, sign up, type in your email, and you'll start getting my newsletters. I put it out there. I mean,
Okay.
I'm not hesitant to share this information with people. And I published what I call 5 steps of my program. And the diet is absolutely foundational. And if you don't eat correctly, everything else is out the window, number
Okay.
1. Number 2, we're designed, and again, I like to look at the paleo model. We are designed to be physical. We're not designed to be sitting at desks all the time. If you look at Paleolithic man, he was pushing boulders, he was climbing rocks, he was building houses, he was out there hunting. I was out on my roof last weekend recoating the roof. I couldn't believe how hard it was. It was more of a workout to do physical labor than to go to the gym. So we're designed to be physical. So exercise is very important. and then avoiding toxicity. And this is very, very difficult because we're immersed in a toxic world, unfortunately, and it can't be avoided. But that's a very important criteria. And then the hormones are also very critical, replacing our hormones as we lose them. And we now, luckily, we have hormones that are bioidentical, and they are chemically identical to our own hormones, and they physiologically work the same. That's a definition of a bioidentical hormone. It comes out of a plant, it comes out of
Do you think it's good for the heart, good for the organs?
I see it improve almost everything.
Okay. So is it that much rewarding? I mean, it sounds obvious, like an obvious one, but it's much more rewarding for you now than when you were in the ER. Because you were saving people's lives, but now you think you're doing something much more special.
So much more. I mean, I have people, and I actually I have a blog on my website. There's a man completely unsolicited, and I took his blog, I took his letter, and I just put it on my website, word for word. There's some grammatical errors in it and everything. I didn't even correct them. And it says, "You saved my life." And I was like, I mean, what could be? And I saved a lot of lives in the emergency room. Literally saved lives in the emergency room, but not like this. I turned this man's whole life around, and he really appreciated that. And it was just a matter of getting him to do the things that allowed his body to heal and get healthy, like being the coach.
Now, insurance companies don't pay for this because they look at it as a wellness or weight loss program or whatever. But I know your fees. I mean, it's affordable. I should also mention, because I say that this is a real interview and I'm not endorsing you on the show, but you walk your talk. I know your age. You look and definitely act a lot younger than your age. But you're physical. You hike and you run and you bike and ski.
I'm out there on my mountain bike every Sunday, and sometimes it scares me because I get my heart rate up. I'm like, oh my God, this is really a high heart rate. But I don't really feel like I've slowed down in 30 years. I go snowboarding, I go skiing, I have a circuit weight in my house. I do training every day. I'm biking all the time. And I think it's very important to stay active.
Now, we talked to the telephone, and we are short on time, but when we got off the phone, I was telling somebody, I said, this doctor, he's got this philosophy that people are going to live like this, or can live this energetic life, and then one day just die. Explain that, because I don't quite get that.
So my motto is live in bold your entire in bold life. And what that means is, instead of having a lifeline where we're living, and then we get old and start to decline, end up in wheelchairs, end up in nursing homes, end up on crutches, things like that, we live a straight linear life like this, and then we just die one day. And there are cultures on the planet that people really do that. There are people in their 90s who are out farming and carrying big packages and heavy things, and they're working and doing everything. They're productive, and they're contributing to society, and then one day they just go to
like their heart gives out or something.
And they just don't wake up in the morning, and they just die, but they've lived their entire life. They didn't have a life where the last 5 or 10 years they had to be dependent on people
like
to
a
take
light
care
bulb.
of them. Exactly, like a light bulb.
You
light
believe-
bulb works, and then one day it goes out.
And you believe that?
I believe that.
Have you
that's
seen some of that
attainable.
going on in your practice?
Well, most of my patients are probably the oldest patient I have is maybe in their early 80s, and I have 80-year-olds who are amazing.
Really?
I have this one guy, he's married to a 50-year-old woman, and she can't keep up with him. And they're traveling around the world, and he's on his bike, and he's hiking, and he's in Catalina, and he's going up on the mountains and all this kind of stuff. He's an incredible guy. And I've had women come into me and say, I think you need to ratchet back his testosterone a little bit. He's an 82-year-old guy.
Is that right?
It's amazing, yeah. And you know, there are people, and more people are going to get to that stage as the baby boomers are aging, and we don't want. Why give up on life? Why give up on life?
Do you think there's in your area? I mean, you're in a heavy populated area. I mean, Los Angeles. You're in Santa Monica, but there's millions of people. Do you think there's millions of people that are in their 50s, 60s, men and women, that are feeling lousy that don't have to be?
There are so many people who just don't realize that they can take control of their life. They go to the doctor with symptoms, and the doctor writes a prescription, spends 3 minutes with them, and sends them out of the office, and they don't get better. And because they're not being empowered. And that's why I give people my manual, why I educate people. Because how do you know how to take care of yourself? It's like taking your car. I mean, you don't know how to fix your car, right? So you have to go to someone who's going to teach you how to fix your car or else fix it for you. Well, doctors don't have time to fix it for you. So you have to get some education so you can take care of yourself. And the more we know and the more information that's out there, the harder and harder it gets. One of the most amazing things I'm doing is all this new genetic information.
Let's talk about your testing, because you're big on testing. You told me on the phone, I get better results now than I did 10 years ago because of the tailor-made, way you're doing things. I'm paraphrasing a little bit, but let's talk about some of these testing.
I'll give you an example.
And how it affects results.
I'll give you a great example. I do this test. It's from this lab called HDL. A lot of the information, it's cholesterol testing. And a lot of the information on the test is genetic information. And I have patients who come in and they're on cholesterol medications. And I look at their cholesterol medications and I look at their test results and I go, you know something? The way you metabolize cholesterol, this drug won't help you. And they've been on the drug for 20 years. So they're taking a drug for 20 years with all the side effects. That is the wrong drug for them.
But it does lower their cholesterol.
But it doesn't lower their risk factors. And I have patients who are taking cholesterol lowering drugs who still have to go in and get stents and bypass and balloon angioplasties and all that kind of stuff, and they're on all the drugs. It's because they're on the wrong drug. It's not the doctor's fault. They're just not doing the
Okay, so you see
testing.
these tests, and what do? Are you able to? Have you ever had people you're able to take off statins?
I take men and women off of medications all the time. It's actually one of my goals for my patients. I classify myself as being non-pharmaceutical medicine. So I like to enroll the body into its own healing. Teach the body how to heal itself. Put back what the body needs. And one of the things about pharmaceuticals, and we are a pharmaceutically oriented society, unfortunately, is the more pharmaceuticals you put into the body, the more you introduce toxicity. Because the body has to handle those drugs. Those are not natural drugs. So you're putting another stress on the body. And everything in medicine is risk versus benefit. Everything has a risk. Do you know that pharmaceutical deaths in hospitals is the 4th leading cause of death in the country? Did you know that?
No.
It kills people after heart, cancer, and stroke is drugs. Isn't that amazing?
So what's the answer, though? So what's the answer to turn this around?
The answer,
at least in your practice.
The
Somebody
answer
comes-
is the 5 steps. Nutrition, nutrition, nutrition is absolutely the basis. We are completely eating the wrong food, and I don't think enough people are talking about that. I love the paleo diet.
You've changed your philosophy. You used to run the Pritikin centers.
I was at
Is that
Pritikin, yeah.
Am I okay to mention that?
In the early to mid 80s, I was Pritikin. And,
Were you wrong?
And
You
I
told me
love
you were
Dathan
wrong.
Pritikin. He's a wonderful person.
You said you were wrong in
We
your
were
advice.
wrong then. We were wrong. Pritikin was high carb, low fat, low protein. And now, I believe, and this is based also on genetics, we go back to the genetic model because we haven't changed genetically in 100,000 years. We're the same as
So you're saying eat the way
Paleolithic man.
humans used to eat.
So you need to eat what we were designed to eat. And what we were designed to eat is what was on the planet 100,000 years ago. And donuts weren't on the planet, and bagels weren't on the planet, and pasta wasn't on the planet. You know when we discovered how to make bread? 10,000 years ago. And you know when we discovered dairy? We discovered it 10,000 years ago. How did we get dairy?
Interesting.
Well, we had to take animals.
So it's new to us.
You had to get animals, you had to teach them how to stand still so you could milk them. You couldn't milk wild animals. So we didn't drink milk until 10,000 years ago. We're very smart. But now we're drinking milk, and milk is an infancy food. It's designed to sustain little babies. So it's got all sorts of nutrients in there for the growing brain and the developing bones and the developing organs, but you don't need that in an adult. And there's no animal on the planet that drinks milk, and no animal that drinks after infancy, and there's no animal that drinks milk after infancy, except humans. And it makes us sick. So many of our illnesses are due to our food. And wheat is the other big offender. We're not designed to eat wheat. Have you ever chewed on a wheat berry?
No.
It's completely inedible. It's like a rock.
So no wheat and dairy.
No wheat and dairy.
Okay, so you get their, okay, so backing up for a moment because we got a little sidetracked that you get them eating right. But back to this testing, you say genetic testing. I mean, you do, some people that come to you are very sick as well.
Yeah.
So you look at cholesterol and you are able to do it naturally. Take them out. What other kind of testing?
And most of the things that we're talking about right now is really in people who are mostly pretty healthy.
Okay.
I also take care of people who are very sick. And one of the things that I do, in the alternative approach is I support the body. So I do things like intravenous vitamins, high doses of vitamin C, glutathione, potent antioxidants, and I can put it right into their veins. You can't get glutathione naturally in your body. I do detoxification. I do EDTA, chelation. There are a lot of people walking around out there who are metal toxic. They don't even know it.
So you do metal tests?
So I do metal testing because sometimes, I'll give you a great example. I had this young woman, mother brings her in to me. She's 20 years old. She's a college student at NYU. She goes to class. She comes home and gets in bed. She has no energy. She can't function. She can't do anything. And she's gained 50 pounds. She's eating a healthy diet. She tries to go to the gym. She's just completely wiped out. She's been to 15 different doctors. Everybody said there's nothing wrong with her. They said she's psychological. She has a psychological problem. She's depressed. Okay? I ran a toxic metal test on her. Mercury was off the charts. Off the charts. Couldn't even measure it. It was so high. I chelated her. I couldn't believe it myself, the difference in this girl. She came back to me 4 or 5 months later. She had lost 50 pounds, and she was herself again. She was a normal girl.
For people that don't know what chelated her, so this is like an IV that goes in.
There's a couple different ways to do it.
Leaches the heavy metals out of the body.
Right. What it does is it binds up the metals.
Right.
It binds it up, brings it out, because normally these toxic metals are in your tissues, but what they do is they poison your cells, so your cells can't function normally. They're poisoned by the metal. And then it pulls the metal out into the bloodstream, and then you excrete it in the urine or through the digestive tract, and you get rid of it.
Is Hollywood, and you're near Hollywood, and I know you have celebrity following, but is Hollywood in on this? Because they look younger now than ever. You know, I mean, a 50-year-old in Hollywood is young.
Yeah.
Very young, 60, 70.
Well, I think the paleo nutrition is slowly creeping into
Combined with hormones?
Combined with some hormones, and then of course there's a lot of cosmetic stuff a lot of people do. A lot of Botox, a lot of filler.
And you like pellet, for people who are just tuning in now, but you do pellet therapy.
So I do, the hormones are a number of different ways. I use creams, a lot of creams, drops under the tongue, injectables for men, and pellets. There are those different modalities.
And it's safe. You're convinced it's safe if given to the right person.
If it's monitored, if it's done correctly, if you're doing it with someone who knows what they're doing, I believe it's very safe.
What about prostate cancer for
It was
men?
a great study on that. They did a study, they wanted to connect testosterone with prostate cancer. So they looked at all these men, and they found that the men with the lowest testosterones actually had more prostate cancer than men with high testosterone. So high testosterone in men actually made them healthier. And it makes perfect sense because it makes the heart healthier. It lowers cholesterol. It helps your bone density. It helps your brain. I mean, you go down the list of parameters of health, and testosterone will contribute to it in a positive way. It's
for women too, though. I mean, you're giving
for women.
testosterone to women. Well, look, we're out of time. I want to thank you so much for coming on the show. They can visit your website, get your blog, and you're taking on new patients.
Oh, of course.
So they can see you one-on-one.
Yep.
Dr. Leibowitz,
Great.
always
Thank
a
you,
pleasure
Randy.
having the show.
Great to see
Really
you.
good stuff.
Thank
You've been
you.
watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you could visit our website at wellnesshour.com, put in Dr. Leibowitz, or you could put in natural hormones. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.